Good evening. I'm David Watts Jr. Welcome to this month's Town Administrators Report via Zoom. With me is our Town Administrator, Steve Maio. Steve, welcome.
Thank you, David, and thank you, everybody, our panelists, for coming out and Zooming with us. A word that we will not want to say again, and hopefully in 6 months, it'll be one of those 7 dirty words on the next George Carlin album. Showing my
we'll have to resurrect George for that one.
Yes, we will.
With us again this month is Ruth Clay, our Health Director, and Tom Walsh, our Emergency Management Director. And joining us for this third update on COVID-19 in Wakefield is the new chair of the Town Council, Ann Santos. Welcome, Ann.
Thank you. It's good to be here.
And let's start off, Ruth, what is the current situation with COVID-19 in Wakefield?
Well, in Wakefield, our numbers have not slowed down. We're still getting several new cases a day. So we're not on the downward slope in Wakefield at this point.
And from an emergency management point of view, Tom, what have you been seeing?
Well, right now, emergency management is concentrated on returning town hall to the public at some point. So first action will be making sure that we've made the buildings safe for our employees to return. We've been on a skeleton staff for about 8 or 9 weeks. So right now, real concentration is on that. And I probably for the next 3 weeks or so, we also have, been getting in PPE equipment that we needed for our public safety. And we're in pretty good shape as far as all our supplies and everything. So the town on that end, on the emergency management level, is good.
Well, and one of the best things that happened most recently was getting masks out to everyone in town, not just the 65 and older.
Yeah, I'll jump in here, David. That was a great team effort by town hall employees, by public employees, DPW guys, teachers, school nurses, of course, the Board of Health, our health agent, health department, Tom Walsh, and emergency management, town councilors. Town councilors came and went door to door and delivered them. And I would say 99% of the public was really very grateful, really touched that we did that. I think we inspired a couple of other communities to do the same. But there are a handful of communities that have gone actually door to door physically to make sure their citizens got some level of comfort and protection during this. I think as important with the masks was a lot of resource sheet, numbers to call, whether you're having a financial issue or a mental health issue or a food security issue. So I was really proud of our entire staff that really worked around the clock to do that. Special kudos has to go out to Judy Luciani at the Senior Center, who took all the calls of people that hadn't received their masks yet because we hit 90% of the town in one day and then took a few more days to get everybody else. But kudos all around. I was thrilled that we got the masks in the first place. That part of getting some of these personal protective equipment has really, we've emergency management team with Ruth and Tom have done a great job. But I don't know if Ann wants to jump in here. Ann and her daughter delivered masks, which was really nice to see. Ann and Bridget, who we all hope to work for someday. And hopefully she's on Pennsylvania Avenue. That's my bet.
It was great, especially being one of the first of the very first community. When we first did it to the elderly several weeks ago, I'm not sure anyone else had been doing that, but people were so appreciative and kind and thankful for our small gesture, frankly, for us to give a few hours of our time. So it was really something to be a part of.
Well, and the great thing about that first distribution was the number of town people who turned out to make the distribution work. You know, the town administrator was there, town councilors were there, Ruth and her people were there. So DPW workers were there. So there was such a wide range of town people that the residents could see trying to make this happen and trying to make it work as efficiently as possible.
Right. You had police and fire there as well. You had school nurses, teachers. At 8 o'clock in the morning, we must have had 50 teachers in line, including the superintendent of schools and his assistant and principals. So it was really, really heartwarming. I almost couldn't get out the packages quick enough for people that were coming in line, and we kept them socially distanced while they were waiting. So it was a good day, or a good number of days, I should say.
Right. And one state rep.
And one state rep, yes.
Yes. State Rep Wong did show up to help out as well, which was great to see.
Yes.
So, Ann, let's talk a little bit about town council and where they're at with regard to the town to reopening now that the governor has started the process. What is town council looking at over the next few weeks as far as getting things reopened and back on track?
Well, I know that not necessarily the town council, but the town has a reopening committee or task force, I should say. And I know that we have at least 2 members on this call. I think following the governor's guidelines, and the guidelines came out, not too long ago. So we just want to make sure that as a town, we are following the state guidelines. Our number one priority is to ensure the safety of our residents. Obviously, we're worried about the financial sustainability of our businesses, but I don't think anyone wants to go too quickly and have something happen where we would have to shut things down again. So town council is taking all of the information. I'm meeting with Steve probably tomorrow. I think we're going to talk in much more detail about it to really know what this next step is. But we understand that the new normal is going to look a little bit different, that we have to think outside of the box, that for restaurants, perhaps doing something hand in hand with Ruth to appreciate that there's certain laws that might need to be tweaked at the state level to see if we can expand a footprint of a restaurant involving a liquor license. That's what gets to be a little bit sticky, but we want to do whatever we can to ensure that our restaurants can open in a way that will be financially beneficial to them. So that's, we're just having conversations and then putting these plans hopefully into action when phase 2, I guess, is where we'll see more businesses opening.
Right, which is 3 weeks away at the minimum.
Right.
Yeah.
We are at the health department working with the businesses now that are able to open this week or able to open next week. So we've been talking to a lot of businesses and answering their questions. Next week, we'll be going door to door with the hair salons and barbershops to give them information, give them copies of posters they're supposed to have up in case they didn't have the printing capability of printing them out. And again, answering people's questions so that we're just going to be there as helping as they open up. Although not all of them are choosing to open up next week, the ones that are opening, we will be there to help them.
Well, the other problem with reopening barbershops, not all the owners live in Wakefield. So how are you going to reach out to those owners that are not local residents?
Well, we're reaching out to them as they open. So we'll be going literally door to door next week, visiting with those who have opened, making sure they have a number of requirements there they have to do, including some signage. And, some of the small businesses just don't have the same tech capabilities, IT capabilities to be able to access everything they need or print out everything they need. So we've been doing all that work, and we will go to them as they open to give them what they need so that they don't have any issues.
And then the other side of it is retail is probably 3 to 6 weeks away from really starting to open again, correct? Steve?
Some retail can open curbside.
Okay.
Right. But in-store retail will be changing. And I do want to highlight this. I don't want it to be glossed over that it is what a great service to have a health director and a board of health and staff that is going to be going door to door with the posters that are mandatory to open. I mean, you do have to have some sort of some compliance posters in your establishments. And Ruth is exactly right. A lot of these places do not have the capability to do that or the understanding that they need to do that. So we're actually going to go help them going door to door. We're not there to spy. We're not there to scold. We're not there to do all of these things. We're basically there to make sure that we can help them in what they need to do. And I think it's just a testament of how great our community is and how great our employees are. So we do have many people on. We have their information, and we'll take that and send them emails or what have you. Another thing we're doing is, and people don't know this, I just got an email from MEMA that has a pretty good set of portals to be sent out that I just sent over to our communications director. So if you have a question, if you have a complaint, if you're looking for guidance, some links to go on that you can get your questions hopefully answered. Because we're getting a lot of questions, and I know that Ruth and Tom are getting, and Ann are getting, as many as I am. How come I can't open? How come hair salons can open and nail salons can't? Question that I'm getting. How come restaurants can't open now, Steve? What about going into my store to buy retail items? How come people can go to Target and can't go to a retail store downtown? A lot of questions that, frankly, I don't have the answers to. The other thing we're doing is we'll be working very closely with the Chamber of Commerce to help them with the messaging and to get their ideas. Ann was completely right. The town council, which has shown great and steadfast leadership during this whole issue, is going to have to make some decisions about parking, expanding the footprint on some of our restaurants so they can expand their capacity, expand their liquor license. And that may mean coming out into the sidewalks, coming out into areas around them. Frankly, we need some state help with that, because of the liquor license, the laws regarding liquor license. And we've been talking about that at the Wakefield Town Council, at least, among ourselves, and I think publicly too, for the last 6 weeks. And just today, I saw a copy of a bill that has been filed in the Senate that I'll be sending over to my chair. So she can certainly look at that and we can lend our support. That gives us the ability to do that without going through, hopefully, a long process that goes through the ABCC and takes 6, 8, 12 weeks, the summer's over and you're just allowed to go outside. Kind of makes no sense. So I think maybe Ian wants to jump in and add something here as well.
I think Steve said it perfectly with regard to us being flexible in perhaps wanting to do things the correct way, but realizing that certain requirements have to be truncated or, through the help of the legislature, policies may be tweaked a little bit in order that we can help some of these folks save the summer. So it's something that we've been talking about well over a month at the town council level. So now it's good to see that the legislature is moving on this. Can I ask Ruth a question? I'm not taking over for you, David.
Sure. No, go ahead.
Ruth, I was in one of our businesses that's opened. It's a takeout restaurant, and they were talking about their really a lot of difficulty in finding that plexiglass or that plastic to go between them and the customer. And this is a really good business. Do you have any ideas on?
I know there is a shortage right now on plexiglass because everybody's been doing it.
Right.
We can try to help. There are some, the mass.gov website has a section under the general business of vendors for a number of different items. So where businesses can purchase hand sanitizer or masks, which are all items that are hard to buy. I haven't looked for that specifically on that vendor list.
Sure.
But some people are using clear shower curtains as an alternative until they can get plexiglass.
Okay,
Being creative.
great. Thank you very much.
Is there a company in Wakefield that does something with plexiglass that might be able to jump in, much like that company jumped in with protective gear that was in the paper recently?
I think that Batten Sign actually is one that has been reaching out.
Right, here in Greenwood.
Here in Greenwood, yeah.
Yeah. So maybe they have a source for getting that material to those businesses.
Excellent. I'll certainly circle back with that business. Thank you.
And Ruth, that also brings up the question, as we reopen and you're watching the statistics from day to day of COVID-19 in Wakefield, what happens if there is an instance that the numbers start to tick up again?
Well, the general guidelines that the state is doing is following state numbers, which obviously is an aggregate, not just Wakefield. Yeah, I do watch Wakefield numbers every single day. If we spike, the Board of Health has been meeting pretty much every week, almost every week. We would have a meeting and the board could make a decision to impose some other restrictions for our area. But in general, the board at this point is removing the local restrictions so that we are in line with the state, so that businesses and the public don't have to worry about, you know, it's different in one town versus another town.
And so far, we've been very lucky here in Massachusetts with the leadership we've been getting on this issue. Couple of other things that you know, people probably want to know about. First off, the town election has been moved to June 23rd, correct?
Correct.
How will that election process be handled, or is that still in discussion?
Ann, do you want to jump in on that, or do you want me to?
I think you should, only because I just heard that there might have been a little change or discussion.
Yeah, there's on the town election, again, waiting for guidance from the state, and the state, things are changing very rapidly with them too. And there's a lot of information that people will get out there, but it hasn't been approved. It hasn't been, you know, officially sanctioned. So what we're looking at the town level is, of course, doing all the early voting, which is the best way to do it. You can get your ballot in the mail, you can download it, you get it, you send it back, you never have to leave your home. You can really make sure that you're protected and your vote counts exactly the same as if you walked into the polling place. One of the items that the town council will be discussing on our meeting on Thursday, next Thursday, because of the holiday, is exactly how town elections will occur. And, you know, there is some guidance from the state that the state does allow the towns, cities and towns within a certain parameter to have the elections, which must be, we must have elections in person somewhere. That has to happen. That can't completely go away as of now, but we could limit the polling hours to a minimum of 4 hours, as long as they begin, I think, before noon of that day. So that is a discussion the council will have, because it's the council that sets the hours. A lot of other communities, I think a few of them already jumped the gun before getting the actual guidance from the state that just came out recently, but that's okay. But that'll be discussed at the council. But I'm going to encourage people, please, early vote. It's very easy. You don't need to leave your living room to do it, other than you can probably leave it with the post office, with your mailbox, and postman can pick it up and send it in. So that would actually be the best thing, because we certainly don't want to expose, you know, any of our town employees, poll workers, what have you. But the on-site election will be in the gym, and it will be the Galvin gym, really spread out. There's a lot of room there, and it will be in that location for some period of time on June 23rd.
And I'm assuming masks will also be required.
masks are required to enter public places where social distancing is not possible. And when you are inside, that is the case.
I think, David, we'll work certainly closely with Betsy, the town clerk. So I know that she would never, we wouldn't want to put any of her workers at risk.
Absolutely.
So probably having a shortened election makes sense. But again, this is something we'll talk about on Thursday in more detail.
And that also leads up to town meeting, which we really need to kind of have an answer on that at some point, because the annual budget for the fiscal year that starts July 1st is top of the list.
That is true. And this is one of the times, David, that maybe we would have, having a representative town meeting would be a lot easier. And I know over the years, that's something that you were never for, but maybe now, maybe this might change your mind.
Nope. It will not.
It will not, okay. That is, again, that the town council did agree to move town meeting. And in conjunction with the moderator, in conjunction with the town clerk, and in conjunction with our health agent as well. We are under discussions right now. What's the best way to do that? I will tell you that the assembly of 10, okay, no more than 10 people, does not apply to the legislative body of the state or municipality. But you really can't social distance for an unknown number that you can't move away inside. So there are discussions going on right now with the town moderator and the chairperson of the town council. It will go back to the town council and in conjunction with our health agent and our emergency management director. But I can see town meeting being al fresco. And just like we had the meeting at the head of the lake of the town council that worked fine, I think that we can certainly spread out in an area, probably Landrigan Field, where we can socially distance, people can be heard and seen, the speaker system and everything, and we can get through that. Because you're right, we do want to set our budget and other items prior to July 1st, because it would be awful to go through a 1/12 budget with the state and having to get money approved every month. It would just be really onerous. So stay tuned on that one. Hate to be vague, but I think a lot is going to come into focus in another week or so.
Yep.
Well, I think if things do start to gel, we can always plan an ad hoc show to get the word out.
Absolutely. Absolutely.
Ruth, going back to the numbers at the top of the show, you said that the numbers haven't slowed down. Is that because there's more testing in Wakefield right now, or is there a spike in nursing homes or other facilities that are here within the town?
Well, that's it's probably a little bit of everything. The nursing homes are definitely a large percentage of our total number. That isn't going up now. That did go up very dramatically for a period of time. That population seems to be pretty saturated at this point. So the numbers, the people that are positive now are not nursing home cases. They are group home cases now. We're getting more of group home cases and the general public. And part of that is increased testing. And part of it is increased people of getting exposed.
And actually that brings a follow-up question on testing. And that is there somewhere that townspeople, if they want to get tested or they feel they need to get tested, can go within the town to get that testing? Are we going to start providing testing to townspeople?
So that's a good question. There is no testing site in Wakefield. However, we are in the process of working with a company to do a public drive-through testing that any Wakefield resident can come to. They do not have to have symptoms. They do not have to be sick. They will not have to be a close contact. They can just, they can be tested. We're waiting for a date. So as soon as we have a date for that, it will most likely be a drive-through at the Galvin, one way, not both ways like we did with the mass.
Right.
As soon as we have a date, we will let people know. They will have to pre-register online. And as long as they have completed the pre-registration process, they will get a time on that day. So it won't be first come, first serve with a large group of people descending on the Galvin. It will be very orderly. And if we can't accommodate everybody in the day that we have set, we'll set another date. So I'm just waiting on a date for this point.
Okay. And that actually brings up another thought, and I'm going to direct this at Tom. You know, one of the best things the town ever did was the Code Red system, which enables town people to get up-to-date emergency information very, very quickly. But I'm not sure that a significant percentage of the town is on Code Red. Is there something that your office can do, or town administrator, to get more people on the Code Red system so they get these notifications in a timely manner?
We have, there's been an enormous amount of people that are on the system, and we go through all of our communications, whether it be on our website, through Facebook, that reaches out to people and says, hey, look at, sign up if you're not on there. I think we reach, you know, 98% of the people out there in the community through the Code Red. I haven't had too many complaints. If anything, I get a couple because it's a little difficult to get off of the Code Red. So if you move out of town and it's on your cell phone, I have gotten those calls in, but truthfully, I haven't had it where I've gotten calls and people said, I've been trying to get on Code Red, because we've had drives and we have a number of people who can, when you call, they can get you on the system. Jen McDonald does it. Even Chief Sullivan can get you on the thing. So we've done the drives. We've put it out there in all of our communications. And I guess I don't believe, David, that is a problem.
I'm looking while Tom is talking here. I think when we send out a normal Code Red call or to the whole entire community, because we can segment if we had to for a specific issue.
Right.
I want to think that there's probably close to 30,000 notifications that go out on Code Red, whether it's email, text, or phone, actual phone. Now, people may get multiple ones.
Right, I get 3.
Right. So, but I think not everyone gets multiple ones. So I think the number is around 30,000+ that goes out on each time. So I agree. I think we cover as much as we can, but certainly we need to cover more. We want to get everybody. So we do push people to get involved, to sign up. It's really easy. So I think it's not. I think it's good. It can always be better, but I do think we hit most everybody through all of the different media that we use.
If I could just say one other thing is that the people who probably don't have it right now are the new people who probably move in town and they're renting, and they maybe on the new rental agreements that we probably have a bit of a note put in there saying that while you're now enjoying living in the town of Wakefield, we would recommend that you also sign up for Code Red system. So you get the notifications. I think if there was probably where there's a disconnect or the people who aren't getting it are probably the new people who are renting, because we're naturally putting up a lot of rental units now. So that's probably the one fail system, but we can do that. When I was with the city, and we did that for all the rentals that we had there to notify that they should do that.
Yep. I do have those stats now, David. Pull it up. 24,307 phone numbers, 3,456 emails, and 4,080 texts. So there is a lot of people that get notified via Code Red, a little over 30,000 as I thought.
Yeah, so it
and again,
sounds like probably with multiples, we're probably covering 2/3 to almost 3/4 of the town.
But you're right, and when we do our Welcome to Wakefield 101, which we sadly had to cancel this year, Code Red is something that we talk to people about. So good point, we can always do more.
Well, I think we've pretty much covered everything we know right now, but I'll do a round robin. Tom, any last comments?
No, I think everything's going good. I think the people in the community should feel safe. Everyone's been working towards it. The town employees have been doing a tremendous job, and that stems from the top, the town administrator, the town council. Everybody's been working together, as you can see, just by even the mass distribution and things that we're doing. You know, the health department. I think we're in pretty good shape, is, you know, just looking for that little extra guidance from the state.
Ruth, how do things look going forward in your department?
We're busy, but we're handling it. We have a really good staff, and everybody's pitching in.
And from the political side?
I don't think of this as political, though, frankly. It shouldn't be. So I from town councils, we're grateful that, as Tom just said, from the top down, that Steve has amassed a group of people in town, heads of departments that are phenomenal. And the transparency and the conversations between them, the collaboration has allowed us to be at the forefront, frankly, of a lot of communities surrounding us. So I think that we are in an extraordinary times. We're doing the best we can to make sure that we serve our community and think about everyone's health. Ruth has been phenomenal. She's been out straight, but she's been doing such a great job in DPW, fire, police, Tom as emergency management. We just could not have asked for a better team.
Something to be very proud of in our town. Thank you, everyone.
Thank you.
Steve, thank you. And thank you especially at home for watching. We will likely, as this develops and continues, come back with more group programs to keep everyone informed. And for now, though, thank you for joining us. See you again.
Thank you all.